Hi, my name is Matthew Colthorpe, and I want to discuss with you guys today just becoming a physician assistant versus a medical doctor. I want to start off by saying that these are two great career choices, depending on what your lifestyle is, which fits you better. These are two choices that I have thought about for a career. I'm going to start off by discussing physician assistant and how to become one. Start off, I did some research on UF's admission website for becoming a physician assistant. Some of the prereq courses you need are microbiology, statistics, Gen Chem 1 and 2. You also need to take anatomy 1 and 2. Other than just prereqs, another thing they require is you to or to be working in the medical field. For example, becoming a PCA, a CNA, you need to have direct hands-on patient care. They require a minimum of 2,000 hours, which is 1 year of working full time. They do like to see you being in the medical field for 2 to 3 years before, but doesn't absolutely mean you're not going to get in. They look at volunteer work as patient care, they look at your grades, so there's other factors. Another thing that you need to do is take the GRE, which is the exam that they require for you to be admitted into school. Other than that, PAs do basically everything a doctor does. They admit patients, they plan out things, they diagnose you. They're more direct patient, like they're in your room more than doctors are. They sit with you longer, they talk with you longer, they see everybody. Another good thing about PAs is you can work in the ED, you can work in labor and delivery, you can move across the board pretty easily. It just depends on what excites you, what makes you happy working in the field. Um, it's 4 years bachelor's degree. From there, you would do 2 years as a master's program, and then you kind of transition right into the field. You do basically a year of working in the hospital, like filling out where you're going to be, and from there, you're certified becoming a PA. This is a good career if you like to be home. There's a lot of 8 to 5 jobs. There's 312s. It's very flexible, but versus a doctor, and you work directly under a doctor, so you're one step below. Pay rate is about 85,000 to 100,000, so it's pretty good pay for 6 years of your schooling. Um, it just depends on your lifestyle. If you like to go out, if you like to be family oriented, then this would be a good career because you'll be home with your family. Um, Transition to like doctors, I looked at the website on UF, the 2016 edition for admissions, and some of the courses that you would need to take there are organic 1 and 2, Gen Chem 1 and 2, Bio 1 and 2, Physics 1 and 2, Calculus, and these are more like harder classes. They're more math based. They're a lot more biology involved. Doctors usually go to school for 4 years bachelor's, then they go 2 years their doctoring, but they go from 3 to 7 years of residency before they can be licensed physicians. So you can be in school anywhere from 9 years to 12 years before you're out in the world being on your own doing like making full money. Doctors also making between $200,000 $300,000. So if you're intense in school and don't mind doing the extra work, then this might be a career choice for you. But you're also less involved in the patients. You do see patients, you see a lot of patients, but you don't get to be as involved as possibly like a PA. You're like in and out of the rooms. You come in, like you ever been to the doctor's office and the doctor's sitting there that long? No, they're basically come in there, they tell you a couple things, and then they're gone. They write your orders, and that's all you see of them. So if that's more like what you're into, and you don't want to be so close with the patient, then maybe the doctor feels for you. But also realize the field that you do pick in as being a doctor is a field you're probably going to end up staying in for your life, because your residency is going to be a lot longer. Say you do anesthesia, that's 12 years, so 8 years residency. And then if you wanted to say work in the ED, then you will probably do a 2 year residency as an ED. So it's a lot harder for you to move from field to field as, say, a PA is. You are also at work a lot longer. You're managing all those PAs. You're on call all the time, so it's more stressful of a job. But if that's what you're into, then that's what you're into. I hope this video has give you guys a little insight. not much time to give you the full details, but I hope this video was able to help you guys understand a little bit of difference between the two are. This is my note card. If you guys have any questions, feel free to ask me.